Good evening, everyone. I'm Denver Mayor Michael Hancock. Thank you for joining us for this important conversation about your health and the health of our community. I'm hosting a series of conversations in response to the COVID pandemic, focusing on the safety and efficacy of the vaccines that are now becoming more widely available for more of us and dispelling the myth and misinformation that may prevent you from making the best decision for yourself and your family. We're focusing on communities of color because the data shows these communities are being disproportionately impacted by the COVID pandemic in both the number of cases and deaths. The virus has killed American Indians and indigenous people, in the US, at especially high rates. But experts and leaders from tribes across Colorado are doing something about it. We're privileged tonight to have several of them here with us for our panel. I want to welcome Adrienne Maddox. She is the executive director at Denver Indian Indian Health and Family Services. DIHFS has been administering COVID vaccines for the last couple of months. We also welcome Rick Waters. He is co-executive director of the Denver Indian Center. Good to see you, Rick. DIC has been partnering with DIHFS and holding COVID vaccine events. Rick is a member of the Kiowa and Cherokee tribes of Oklahoma and has worked in Indian country for over 40 years. Jennifer Wolf, she is founder and CEO of Project Mosaic and has worked with dozens of nonprofit organizations. She is on the Johns Hopkins Center for American Indian Health COVID-19 Communications Advisory Board. We got some deep people here. And finally, someone I've known since my teenage years, Darius Smith is director of the Anti-Discrimination Office in Denver's Agency for Human Rights and Community Relations and the American Indian Liaison to the City and County of Denver. I want to thank all of you for being here and representing several different tribes and perspectives. Each of our panelists will take a few minutes to share important information on how COVID is impacting Native American and Indigenous communities and what is being done to help. Adrienne, we're going to start with you. Again, thank you for being here with us, and we're going to have a good conversation. You have seen the impacts of this pandemic up close since the start. Can you talk a little bit about that?
Absolutely. Thank you. It's a pleasure to be here today. I am a member of the Hopi tribe in Arizona, and I have been with the Denver Indian Health for 13 years. Early on during the pandemic, as it swept across our states, our initial concern was how the virus would impact our community and our clinic. We tried to stock up on the essential PPE that we needed, but it was unavailable. So it took a lot of advocating, coordinating to get the PPE that we needed so that we could start testing our community. And that was a huge effort on its own. But moving forward, when vaccination plans were being drafted, we had to decide who we wanted to get our vaccines from, Indian Health Service or from our state. We opted to go with Indian Health Service because we do have a contract with them, and that is the purpose of our clinic. So in early December, we received our first vial of Pfizer vaccines. We had to make a trip down to Albuquerque to get it, and it only allowed 5 vaccines. So it did vaccinate our frontline providers. And since then, we have been getting Moderna. And as of last week, we started getting Johnson & Johnson. Vaccine hesitancy is a public health challenge in tribal communities, especially given the federal government's history of medical abuses committed against Native people. The Urban Indian Health Institute surveyed Natives and found that 75% are willing to get vaccines, mostly out of sense of responsibility to protect their communities and preserve their cultures. So that suggests that culturally relevant messaging is key to building vaccine acceptance. Misconception and vaccine hesitancy has created a slower distribution in our community. And within our own program, we've had feedback that people want to wait to see how it affects others, and many people still believe in the conspiracy theories around the vaccine. Our current infrastructure does not have the capacity to vaccinate our eligible members. It is not large enough. So we have partnered with our friends at Denver Indian Center, providing vaccines in their gym every Friday. Individuals are eligible for the vaccine if they are an enrolled member of a tribe. Non-Native members are eligible if they are in a household of an enrolled member, or if they are a caretaker of a member, or any employee of an Indian education program, department, school, or business. As of today, we have administered 1,053 vaccines. Priority tiers are being followed, but we are moving quickly through those tiers because our population is much smaller. We are currently vaccinating and getting people in 20 and older with underlying conditions. To keep up with the demand, we brought on temporary staff. It really has been a huge event. It's like planning an event every week. But we did build a call center with temporary RN staff to alleviate the front desk handling calls related to COVID vaccines. In our data entry center, we did build staff to help with the workload on registration. I really applaud our staff. Aside from vaccine distribution, we are still running a regular health center. Our staff, they're tired, but they are really excited about getting people vaccinated. Our goal is to vaccinate our communities so that they can be reunited with their families.
Thank you for that very detailed information. Let me clarify a couple of things. 75% of your constituents said they plan to get vaccinated, mostly out of a sense of responsibility, but you also acknowledge the importance of culturally relevant messaging. Mm-hmm. Can I ask you to expand on that a little bit more? And how was it so effective with the American Indian community?
We find that due to historic trauma, many of our families don't want to hear messaging from the federal government, just for obvious reasons. Mm-hmm. So it was really important that this messaging is coming from the community itself, from members, like our clinic, the Indian Center, people all on this call today, because it's important that we're hearing it from community member to community member. If we're demonstrating that this vaccine is essential, then we're trying to change that stigma of the conspiracy around vaccines. Many people feel that, we're just going to get COVID if we get the vaccine. So we're trying to correct the messaging that is out there.
I appreciate that. Rick, thank you for joining us, by the way, and it's good to see you, my friend. You have been one of the people who I've turned to for a better understanding of our American Indian community and Indigenous community. What have you heard in terms of the concerns, doubts, optimisms with regards to the American Indian community?
Thank you, Mayor, for inviting the Denver Indian Center to be a part of this discussion. In regard to the vaccine, I've had the opportunity to hear a wide range of opinions coming from Indian people across the country, including Denver, ranging from those that feel the vaccine is a government conspiracy to continue the genocide or termination of Indian people, to those in support and endorsing the distribution of the vaccine to everyone, as soon as quickly as possible. However, the most common sentiment I've heard expressed is the concern over a number of tribal elders that we have lost and those that remain at risk of contracting the virus. And to that point, with respect to the political, religious, scientific, and cultural influences or differences around the vaccine, I'm observing a collective or concerted effort by tribes and individuals to participate and seek getting the vaccine as quickly as possible. And much for the reasons everyone wants things to get back to normal so that we can begin to gather again safely at social events such as powwows, ceremonies, funerals, celebrations, which are all important to Indian people because we are a very social oriented group of community. In response to the doubts and rumors expressed about the vaccine, I encourage people to gather as much information as they can from reliable sources when they're discerning or deciding whether or not they should take the vaccine. For our local Native community, the Denver Indian Center employs a staffed COVID Native response team that is prepared to take calls and respond to individuals that may have questions about COVID or just need additional support to help cope with stress and anxiety that's been brought on by the pandemic. In addition, one of the most frequent requests received by the team has been, where are nearby testing and vaccination sites, along with what are the eligibility criteria and how do they schedule an appointment? So the team keeps a current list of local sites providing tests or the vaccine, but generally we refer to the Denver Indian Health and Family Services. We're just very excited to continue our partnership with them. We consider them a sister organization, actually. Since implementing the native COVID team in the late fall of 2020, we have received over 1,600 inquiries or encounters with people calling and wanting to get more information, not only about testing, but the vaccination itself. And we have a team that I think Adrian alluded to is made up of people that are trusted by the community. They're not necessarily a formal psychologists, but there are people that are aware and knowledgeable about cultural aspects, and our community responds to them. And this program is funded by FEMA and will run through the June of this year.
How long did it take for the various key organizations within the American Indian community to begin to ramp up upon the beginning of this pandemic to say, we got to come together and go to work? And what other hurdles did you all experience in terms of the community acknowledging the seriousness of this pandemic?
We jumped on it right away, almost to the year. I think we're recognizing and celebrating, well, not celebrating, but recognizing when COVID first started. And I remember making calls to Adrian and the Denver Indian Family Resource Center and other organizations to see what we could do and find out what are the needs, what are the fears of the community right now. And we administered some surveys to the community with a focus on our elders again, just to get the feedback. And it was interesting to see what the response was with respect to making sure communication lines, what were their concerns and issues. But almost immediately we began, and not only our organizations, but community representatives from around Denver and Colorado started coming together and seeing what we could do to provide opportunities for our community to navigate this pandemic, from food to transportation to issues around their rent and utility bills, and just kind of the whole gamut of things that everybody was facing, but especially our community.
Thank you for that. And we want to welcome Jennifer Wolf from Project Mosaic here as well. Jennifer, first of all, I got to tell you, I was really excited to hear that we had an advisory member to Johns Hopkins, which has been ground zero for tracking the data from this virus. And every time you're watching, doesn't matter what station, Fox, CNN, ABC, NBC, CBS, they are using data from Johns Hopkins to track and to inform America how we are being impacted by this pandemic and by this virus and the pandemic. Can you talk about the impacts that you've seen?
So yeah, first of all, I'd just like to greet you in our traditional way. Buju, Jennifer Wolf, Nindishnakas, Ishkwe Gijugum, Kwe Nindigo Jibomag, Swans Lake neighborhood, Nindanangum. Greetings from the ancestral territory of the Cheyenne, Arapaho, and Ute tribes, and I greet you warmly in my Ojibwa language. I am the owner of Project Mosaic, which is a consulting firm that works with tribes and Native organizations across Indian country. I have my master's in public health, so a lot of what we do are public health strategies, communication strategies, social media strategies. Yeah, we are just really trying to use, you had asked about, how we are responding to this. And we are really focusing on reminding folks that Native people have adapted and endured 500 years of pandemics and injustices. And the way we've survived is by leaning on our greatest strengths. We wouldn't be here if our families were not fiercely protective of our loved ones, especially our elders. And we're also an incredibly resilient people. And we continue to value our elders as culture bearers, storytellers, language keepers, and are linked to our ancestors. And you will also hear from many Native Americans and when they speak about 7 generations. And this is the idea that what we do now will affect the next 7 generations. So really, a lot of what I do is strategic planning, but Native Americans are the natural strategic planners because they're thinking 7 generations down the road. So one of the other assets that our people have that a lot of people from outside our communities are not aware of is our sense of humor. Others may see us as a very serious or stoic people, but in reality, our ability to laugh together has gotten us through centuries of hardships. And Indian humor, as it's called within our own communities, is a way that we build trust with one another. If you can tease, you can forgive. And if you can laugh, you can connect. So those are also very important tools in health communication strategies. But speaking of trust, the flip side of that is something that Adrian mentioned. And it stems from our protective nature that I was talking about. We're very cautious about trusting outsiders and institutions, and with good reason. We aren't just going to wear a mask or get a shot because the government tells us to, because listening to the government without question hasn't worked well for us in the past in many situations. So that's why it's extra important for our communities to demonstrate and role model health behaviors from within, and to remind ourselves that our core values include protecting one another. Wearing a mask is a sign of respect and strength, and getting a shot is an act of resilience. And so that's how we behave as modern day warriors today. I'm just really want to applaud Rick and Adrian and so many of our sister, it's amazing that they call each other sister organizations, because we really do act like a family in many ways. We've pulled together so well to launch some incredible public health communication strategies. And the collaborations have happened between our community partners of not only the Colorado Commission of Indian Affairs, but also the Denver American Indian Commission. That meant that allies from over 30 organizations and our two tribes, in Colorado, the Southern Ute Tribe and the Ute Mountain Ute Tribes, worked together to create culturally appropriate infographics, PSAs. We have a text hotline for COVID and community resources. Project Mosaic helped bring some of these ideas to life, but really the heart and the soul of these campaigns was the community and the community partners. And we leaned heavily on those Indigenous cultural values to inform the strategies, remembering that we are not victims in this crisis, but we are empowered to protect one another through mask wearing, social distancing, hand washing, and now the vaccine. So the PSAs and the materials definitely featured well-known leaders and elders demonstrating these acts of love, including Adrian and Rick. But Rick also mentioned the survey. One of the surprising results from that I will also bring up is, they asked the elders, what sort of hardships are you facing? Housing insecurity, food insecurity. Mm-hmm. And one thing that really got to my heart was that a lot of our elders said that they're lonely, they're facing isolation. So, being that we value and we honor our elders to such a high degree, that was just an important reminder to all of us that we need to be checking in on one another, because our elders are feeling lonely.
Because my follow-up question to you was going to be, we've just experienced an amazing year where many of our elders, many of us, all of us, have been isolated and cut off from our normal way of going about our lives, and wondering what the coping mechanisms were for the American Indian community to help each other get through the very difficult times over the last year.
Well, I would just like to see more of what some of the good work that's happening on the Southern Ute Tribes and the Ute Mountain Ute Tribes. They're doing a lot of cultural sharing activities virtually, where young people can get online and learn how to make fry bread, or learn how to make a ribbon skirt, or learn how to do some of these traditional things. And it's really making the elders feel valued, and it's providing new opportunities for youth to learn some of these cultural assets.
Let me turn to Darius, who is a native of this great city, and someone, again, I've known since teenage years. And now, how long have you been with the city, Darius?
17 years this month.
So we started the same time. You started 2 months before I did when I came on city council. But Darius, every panel we've done on this COVID series, we've had a survivor. And so I was surprised to learn that you were our survivor today, having contracted the virus and actually was hospitalized with the virus. And I also understand your beloved mother contracted the virus. Talk about your experience a little bit. People don't realize that most people came out of that experience.
Well, it was a shock. November 19th, roughly, I got sick. I was playing golf out at a Green Valley Ranch golf course, and I just wasn't feeling well. And within a few days, I ended up at a clinic at Kaiser, and I had a coughing spell. And basically what they told me, I had been coughing for 3 hours straight. My stomach muscles were just tightening, cramping. I was there. They took a quick test. They did a rapid test, showed that I had it, called the ambulance, and I was over to St. Joe's for 8 days. And I ended up losing about 20 pounds, but great care. The doctors, hospital staff was wonderful. It was a wonderful facility. And then I get out, and 2 days later, my mother took a turn for the worse. And I get emotional about it because I was more scared for her than myself. And she ended up being there for 11 days. And she took a while to recuperate, but I saw her yesterday, and she's walking a lot more. She's using her Fitbit. She's getting steps, trying to get 10,000 steps every day. And we kind of have a little competition within all the family members. She's doing great.
Appreciate that, Darius. And I know we're all glad to see that you're healthy on the mend and doing well. Any side effects from your
No, the interesting thing was I was very emotional. I would say a couple of weeks afterwards, and I got a coffee from a brand new Dutch Brothers, and they wrote we were it was a long line to get my coffee, and so the woman knew that I was having coffee for the first time in 3 weeks, and so when I got up there to get my coffee, they wrote, we're glad you're well and we love you. And when I saw that, I just started crying. And I think that's what happens with a lot of individuals who deal with this. Is it's a very emotional thing. And we have organizations like the Indigenous Center and DFIS to help with moving people from that isolation to have the ability to talk with people who are positive and people who are encouraging and saying, you're not alone. And I think that's important. And so thank you for having this panel today.
No, absolutely. And again, we're glad that you and Mom are doing well, and keep on keeping on. I think that the survival stories have been very important to share. That one, we all have been victims of this virus, no matter what community you come from, what socioeconomic group you're from, and two, you can survive it. But more importantly, before we go, there's always a series of questions I'd like to ask the panel just briefly. Are we all in agreement that we should be encouraging our community members to get this vaccine? And Adrian, can you talk about how it felt when you completed have you completed your series?
I have. I completed my series in December. I lost my mom in October.
Oh, sorry.
So it was really important to me to be with my dad. And so it was getting the vaccine was an urgency. And not only that, but I needed to do it for the clinic. And so I had all my series, and my whole family has that are very close connected with my father.
Fantastic. Rick, how did it feel when you completed your series?
Obviously the relief was there, but literally I had just a little bit of a sore arm, but I know different people react differently. I had good friends of mine that really suffered the following day, but it went away very quickly. And again, it's that sense of, I guess, assurance that we're less likely to catch it and have the most devastating effects.
Jennifer, do you have your series of shots done?
Yep, I have.
And what was the first thing you did when you got your shot done?
Oh gosh, it was such a relief. It was a weight off my shoulders, but really didn't compare to the weight that came off my shoulders when my parents got vaccinated, because every act that we've done, social distancing is everything, has been to protect them.
Good. Okay, so this is the last segment that we do this thing called Bust the Myth. And basically we try to dispel whatever myth we may have heard out there from our particular community. One of the myths that I've heard is that you have to pay for this, it costs. And I'm gonna bust the myth. This is a free vaccine. The United States government paid for us as American citizens and residents of the United States to be vaccinated. Let's go to Rick. Rick, can you bust the myth?
Yeah, the first one, and it hit early on, was I was getting a lot of calls from people in the community saying, we're not worried about it because Indians don't catch COVID. So that definitely was a myth. Then shortly after, we had a lot of particularly in Navajo country and then even in Oklahoma, my home state, very rampant spread of the disease. But
I hear a lot of different ones, and we did have a patient that said his mom told him it would make him sterile, and that is not true.
Oh man, would the vaccine would make him sterile or the virus would make him sterile?
The vaccine.
Wow, wow. Thank you for busting that myth.
Yes, well, I have to collect these type of myths because we're creating a response guide for Johns Hopkins Center for American Indian Health. We have a whole spreadsheet of, we collect these and we come up with a response, and some of them are scientific and some of them we try to have like humorous responses sometimes too. I heard some say it's a government scandal that there's a chip placed inside the vaccine.
Oh,
Honestly, if the government wanted to track you, they've got a much better way to do it in most of our hands right here. They wouldn't need to put that in our bodies. We all give them a much more efficient way to find out everything we're saying and doing and everywhere we're going.
well, I will say that in all the series we've been doing, that these are the best myths that I've heard, and I appreciate you all playing along and busting the myth for us, and also for taking the time to have this conversation on this very important topic for our American Indian and Indigenous communities. This is an important time for all of us, critical, as we are about to see more vaccines come into our state. We need to make sure our people get vaccinated. Hey, I want to again thank the incredible panel of experts who joined me for this important conversation, and our partners at Rocky Mountain Public Media for helping us reach as many of you as we can. And thank you for continuing to wear your mask, socially distance, and avoid gathering with people outside your households. Together, we will move from rescue to recovery.